Hello, everyone. If you are logging in right now, we're going to give everybody just a few minutes to get on. We've just opened up the broadcasting so you can get on. We'll just give everybody a couple seconds and then we'll start. Good evening. It's 7 o'clock, so we're going to get started. Lots of people have already logged in, so you're clearly excited for our town hall tonight. We are too. So good evening. I want to thank you all for joining us tonight. This is our second virtual Canterbury Foundation Town Hall. I'm Catherine Bangle with Bangle PR, and we work with Canterbury to tell positive, happy stories, document all the things that happen inside Canterbury Foundation for both social media and their website. And since COVID, we have also been helping with the communications around COVID and Canterbury. Our goal has very much been to keep everyone from staff, residents, and resident families up to date as we get continuing changes from the Alberta government and Alberta Health Services in terms of what's going on inside Canterbury and what is allowed inside Canterbury during COVID. And so tonight, if you join us, the last time we did a town hall, we are going to do one thing new tonight. You will see there will be poll questions on the town hall. And this is just for us to be able to gather some information about how you want to be communicated with and how well of a job we're doing in terms of giving you all the information you need. So that you can come in and visit and feel welcome at Canterbury, so that if you live in Canterbury, you also have all the information you need with what is happening and what is the most up-to-date information that we are getting around COVID. Wendy is also going to be giving a bit of an update on the flood remediation that's going on. So you'll also be able to ask questions not only about COVID-related things, but about flood-related issues as well later on after Wendy's done her presentation. So tonight, as I said, we have Wendy King, the Executive Director of Canterbury Foundation. She's going to be outlining the new visitation policy and the guidelines, as well as doing that update we have on a bit of the flood remediation work going on inside Canterbury. You'll also have the opportunity to ask questions following her run through with the Director of Health Services, Heidi Hadubiak, who's joining us tonight, as well as our Enrichment and Programming Department. We have Mambalia Kamara, who is the Resident Experience Manager at Canterbury, available for you tonight to ask questions. Now, for those of you joining us via Zoom, You'll have the opportunity to type questions on the side of your screen. I'm going to have a few helpers here tonight who are going to relay those questions to me so that I can then provide them to any of our speakers here to answer them for you tonight. And for those of you joining us on your phone, you can email us your questions at community@canterburyfoundation.com. Again, we're going to be monitoring that email account tonight, and you can ask questions through that email as well. So without further ado, I want to introduce Wendy King, the Executive Director for Canterbury Foundation, who's going to give you a bit of an outline of the new visitation policy here at Canterbury. Wendy, take it away.
Okay, thank you so much, Kat. So good evening, everybody. I would like to thank all residents, families, and community members for attending the town hall tonight. We really do appreciate your support as we navigate through COVID and, of course, this other complication, flooding during the midst of all of this. So the goal for this evening is to go over the new visitation guidelines and what that means to you and your family, and how to visit your loved one while keeping everyone safe. And we are also going to give an update on flood remediation and water damage, as Kat mentioned. So just going to go over now a few of the key parts of the visitation guidelines for families, just to get the conversation started. So first of all, indoor visits. Visitors are only able to visit in the residence suite, not the common areas. And so all indoor visits in the manor, the court, and the lane must be booked in advance. And visits in the common areas, when they would be available, must be approved by health services. Visitors must wear a mask at all times, even within the residence suite, and maintain physical distance of 2 meters. There will be a maximum of 2 visitors plus the resident, and those 2 visitors can only be the designated family member and or support person. So at this time, visits can be scheduled from Monday to Friday from 9:30 to 4:30 p.m. And we did do a survey to ask families when the best times would be to visit, and we had a resounding response that weekdays were the best. So at this time, due to staffing constraints, we aren't offering weekend visitations. We're also asking that visitors, when they are visiting their loved ones in the suite, to talk to the RN, or if you want to talk to the RN or someone at the nursing station, you should ring the call bell within the resident suite and stay in the suite. So for outdoor visits, masks are strongly encouraged and physical distancing must be maintained. Booking is no longer formally required, but book visit must be given priority due to the availability of outdoor visitation spaces. Outdoor visitors are not permitted to enter the facility, and that includes the courtyards. So the number of allowable visitors has increased in the manor to 4 visitors plus the resident, and in the court, 3 visitors plus the resident. Visitors will be allowed in extenuating circumstances where they would not be subject to limitations, in cases where it's the end of life, their last 4 to 6 weeks of life, pressing circumstances such as medical, social, or spiritual crisis, or a significant change in health status, or financial or legal matters, and a family crisis. When visitors arrive at Canterbury, they will be required to undergo a mandatory health COVID-19 screening. That includes a temperature check, a signing of a waiver, which includes signing that you have read the visitation guidelines that were sent to all the families, and the waiver as well. And these will remain on file for all future visits. In phase 1, we will confirm that visitors are the designated family member and support person. So anyone coming in has to be confirmed that they are on the list as being either one of those 2 persons. The education will be provided on safe visiting practices, and appropriate PPE will be supplied. Visitors will sign in and out in the logbook, and that's for safety purposes and for contact tracing. We do have a COVID out hotline available for questions on visitations, and that number is 780-930-5580. I know that for some families, these steps do seem extreme. However, in the last few weeks, we have seen a jump in the cases of COVID-19 in the Edmonton zone. And so we do have seniors facilities that get on the list as having a COVID outbreak, and some of them drop off, but there's always new ones added on. And as of today, I believe the number of seniors facilities with a COVID outbreak in Edmonton is 10. So we haven't yet had any cases of COVID within our walls, and that is due to everyone's diligence and care. And so I can tell you that we very much appreciate everything that you're doing to stay safe. So to put this into perspective, if you think about how many people that you as one person come into contact with in your day, you bring all of those contacts into Canterbury when you visit. Multiply that by every other visitor who enters our walls, and our risk of COVID multiplies exponentially. If you want to visit loved ones at Canterbury, this means that you're taking all mask wearing precautions in your day-to-day lives very seriously, that you're limiting your exposure to others as much as possible, and that you're educating yourself and following Canterbury's visitation guidelines. So I just want to talk a little bit about the flood, just to give you some information. So we had a flood in the courtyard, and that was during the extreme heavy rainfall that we had on July the 16th. And so we had several suites that were flooded, and that affected the carpeting in those suites and affected the lower part of the walls, and it affected some hallways as well. So there is high moisture levels that we're monitoring daily, and as well we are testing the air quality. So we had to move residents out of about 22 suites to other areas of the court. And I think we had to move one resident to the manor due to space. And so Imbalia, who's on the call tonight, has been working with the affected residents and their families. And we really do appreciate how much cooperation that we've received, and how everyone has just accepted, not always accepted easily. I know it was a difficult time, but they are dealing with it quite well considering. So currently we're working on removing the carpets and repairing the walls. The flooding did affect some common spaces at Canterbury, which is also another reason why visitation in common spaces is not allowed, as we're short on space also due to the construction, the interior renovations. So we want to thank everyone for their patience as we deal with this flood situation, the new visitation guidelines, and the global pandemic. Your support is very much appreciated, and we value your cooperation and feedback. So I would like to turn this now over back to Catherine Bengal, and she will take that over and introduce the questions. Thank you.
All right, thank you so much, Wendy. We appreciate all that. We're now going to open up the Zoom call and the phone lines for questions. We did have some questions sent in prior to our town hall starting tonight, so we're going to go through some of those as well if you did send them in ahead of time. You do have the opportunity to ask Wendy, Heidi, and Mambalia questions related to the visitation policy as well as the flood remediation. If you are on Zoom, again, please type your questions on the side of your screen. And if you are joining us via phone, you can send your questions into community@canterburyfoundation.com. And I will say that those are the only questions we're taking tonight. If you do have questions about the construction going on at Canterbury or anything else personal, please send those into our email and we will answer them directly after tonight's town hall. You will also only get one question. There won't be any follow-up. So hopefully if you do have a follow-up question, it will be answered within the evening tonight. And if not, please again, just send them to that email at community@canterburyfoundation.com and we'll get back to you with an answer in the next couple days. Okay, so our first question tonight is for Heidi. Where did my question go? Oh, there it is. Okay, what are the main changes at Canterbury in response to the latest visiting order? Go, Heidi. Do you hear her?
There. Yeah, sorry, just trying to unmute, and my apologies for some last minute technical camera issues. So good evening, everyone. Thank you for the question. So in terms of the biggest changes, I think Wendy has covered a fair amount of that in terms of what you can expect to see. What we decided to do as the new orders came out, again, if anyone was here at our last town hall, we saw orders that were fairly lengthy and lend themselves well, these ones, as well, lend themselves well to being a phased approach. One of the important aspects of the latest order was that we included the feedback from residents, family members, as well as our staff as it relates to what the risk tolerance was, or is, I should say, with regard to the risk of COVID exposure. And because of that and the need to get that feedback in, we decided to go ahead and open up some initial first steps, which is phase 1, and I'll speak to that in a moment. But I just wanted to mention that now that we've had a chance to get that survey out, thank you to those that have contributed or had contributed to that. It was very clear to us that the risk tolerance for both the family members and residents, as well as the staff, is quite low. So that helped to guide us in determining how we would sort of launch phase 1 of this. So when we talk about phase 1, that's the guidelines that have been released and that are on the website, as well as have been sent out in email and hard copy to our residents. The intention there was to open up visitation while assessing how we move forward, as well as ensuring that we have operational requirements in place to ensure the safety, given that there is the requirement for the screening, and a bit of education around mask wearing, social distancing, how the visits can happen, where the visits can happen within the facility, and also the fact that there is now a waiver and an agreement to sign once the first time you come in, to acknowledge that you are aware of the guidelines and just in agreement to your responsibility to be following those precautions that are in place to keep everyone safe. So from there, we took that first step to look at the online system that we had been using for outdoor visits to help people to access visitation for indoor visits, beginning with Monday to Friday daytime access. And that was based on the residents being able to identify not just one as previous, but now 2 designated visitors that are able to come and visit. At this time in phase 1, we haven't opened that up to further social visits. So it is limited to the 2 identified designated visitors who can visit once they've booked each of those once a week. So the resident themselves can have up to 2 visitors once a week. We, again, are just putting that limit on so that everybody can access the system and have an opportunity to ensure they get a time to visit.
Oh, hi, I'm unmuted. Okay. Our second question is for Wendy. Wendy, is there a time limit for visitations?
At this time, yes, I believe, Heidi, correct me if I'm wrong, I believe that we're asking people to limit their time to 1 hour. And that is simply because we need to know how many people are in the building at any point in time. And if we do have lots of visitors who want to stay an extended period, that puts safety in question in the event of an emergency. So we're asking people to limit their time at this time.
All right, our next question is for Mombalia. For both inside and outdoor visits, how do we arrange a visit?
So right now, for both of those visitations, you can book those online. We are using a platform called Acuity Scheduling. And what we require is that the designates can notify our life enrichment team, and we will ask for your email address, which will then allow for us to send you a link. and that is the means for which you can use that. So if you are a designate, you already would have that information, but if you haven't received that from us, just give us a phone call at our Life Enrichment office, which is 780-930-3736, and then we will get your email address and send you the link.
Amalia, can outside visits be booked on weekends?
Yes.
Oh.
Yes, yes. Presently, outside visits can be booked on weekends. And as Wendy mentioned, I believe if you want to use our predetermined spaces, then we do ask that you book your visits so that you have preference on that space. However, if you are just wanting to pick your loved one up and take them for a drive, you don't necessarily need to book that. For our residents in the port who may need assistance to get downstairs, we are asking that you book that, because that just allows for the healthcare team to be aware of whom they should be assisting at a prescribed time.
All right, our next question is a two-part question for Heidi. Question one, when will the second stage of the policy be implemented and what will be included? And the second part is, in the second stage of the visitation policy, will 2 visits per week be allowed?
Sorry, team, we will get this muting and unmuting sorted by, I'm sure, the end of the meeting this evening. My apologies. Thanks for the question. So I think there are a few moving parts as to the exact answer for when phase 2 will be implemented. We are currently working on a couple of aspects that are key to moving forward. One is there's a subsequent order that we're waiting for from the chief medical officer of health that allows us to bring volunteers back in to assist us with the increased volume of visitors coming in and the screening, as well just the opportunity for us to see how phase 1 is going and ensure that we're able to manage the current volume of people and the processes that we have in place. So we're hopeful and we're aiming for mid-September for a phase 2. And as always with COVID, we're watching the environment, what's happening in Edmonton as it relates to COVID numbers, and potentially how much risk that might pose to expand and open up further at that time, which could further delay. But we're hopeful for mid-September at this point. What we would look to bring in at that time would be opportunities to book our evening and weekend visits, similar to what we have with the outdoor visitation. Additionally, if to answer the question about 2 visits a week, if we're able to manage the volume and things are going well with phase 1, we would potentially to expand the number of available scheduled spots to book, which would open up the opportunity to have more than 1 visit per week. And third, I think the other piece that people are eagerly awaiting is an opportunity for some of those social visits. And that means, excuse me, visitors other than the 2 designated visitors that are on each resident's list would be able to book and come and visit over and above those designated visitors. So those would be the 3 key things that we're looking to move towards in our next phase.
Okay, Heidi, our next question. What are extenuating circumstances when someone other than the designated family support person is allowed to visit?
So there's thank you, good question. There's a couple of details around what we consider extenuating circumstances. And I apologize, in this case, I'm just gonna refer to the exact definition, so because I don't have that memorized. The three that are listed in the order specifically are end of life, which is a situation where we are looking at a palliative scenario, and that has been expanded from the first order to include the last 4 to 6 weeks of life. Previously, we were limited to, the last 48 hours, which, I think was challenging for families because that didn't provide a lot of time, as well as, it's very difficult to know and predict in those situations. So the opportunity to have family members and loved ones there and beyond just the designated visitors during that end of life period has been addressed in this order. The second one is pressing circumstances, which is defined as some sort of significant change in a medical, social, or spiritual situation for a resident. So if there's some sort of personal crisis, some sort of change, excuse me, that we're concerned, or the family's concerned, or the resident is concerned with, we have the opportunity to work with family in terms of increased visitation. So some of it's around potentially more increased number of visitors, but also the opportunity for longer, more frequent visits than our current schedule. And the third is significant change, obviously, in health status. That would be the third. Oh, sorry, this is the copy I have is flipped. The pressing circumstances is the financial, legal matters, or family crisis. And then the third being the significant change in health status, and that can include an emotional issue as well. So in any of those situations, we have the ability to allow other visitors than the designated visitors, as well as some exceptions to the timeframes and frequency of visits.
Okay, our next question is for Wendy. With an increased level of potential exposure, how is Canterbury protecting residents?
Very good question. Thank you very much for that. So one thing that we are doing is that we are asking all of our residents now to wear masks in the common areas of the buildings. So we felt that that was important, and as you can imagine, that is a bit of a challenge, but we are enforcing that as much as possible and providing that level of education, because many residents are worried about increased exposure with visitors coming in. So with visitors coming in, we are being very strict with respect to mask wearing, with respect to social distancing, and doing a risk assessment of any visitors who are coming in. So, those people who are high risk visitors, then we would suggest do not visit until you have reduced the risk. So and that means if they've been around anybody that might have been at risk for developing COVID, if they've done any traveling, if they are out and about frequently in, getting involved in groups, or if they work outside the home, that sort of thing. So try and reduce their own personal risk as much as possible, so that we are reducing the risk of COVID coming into the building. So we are also, we still have maintained single site staffing, so we still have that as a one risk mitigation strategy. And what am I missing, Heidi? And so we are constantly as well, daily resident checks and screening, and we screen our staff and any visitor or any contractor or anyone else who comes into the buildings. We're being very strict about that. And of course, education and constant reinforcement are something that we are very diligent about as well.
Okay.
And as well with our staff, we're, just to reinforce, as well with our staff, we are reinforcing with them to be very careful about what they do when they're, during their off hours. course, you know, we can't put them in a bubble, but they certainly can manage their own risk, and this is what we ask them to do.
I think, Wendy, and that's a great response. I think that covers the large majority of what we're doing. There's just, I mean, additionally, a lot of individualized discussion, problem solving, education that the team is doing. We work closely with public health and, as required, the medical officer of health to look at different scenarios as they present in order to find the safest way forward for different situations that may arise. Mentioned again that that idea of the phased approach here with regard to visitation. Excuse me, the intention there was also to help to manage that, you know, as we slowly open the doors to the first set of visitors and make sure that that group is educated, you know, is able to find their way around, know how best to keep the residents and themselves safe. We can gradually open up to more and make sure that when people are coming in, we're providing that one-on-one education. As Wendy mentioned, that risk assessment, we can work with people to kind of determine what activities may be posing increased risk and what that means for them in terms of visitation, as well as really effective screening for any symptoms or potential exposure. So yeah, I think otherwise you covered all the main points, Wendy.
All right, our next question is from Mombalia. Find your, oh, I think you are unmuted already. Mombalia, what types of activities should residents be expecting in the coming months?
I think they will be seeing that we're starting to provide a little bit more of the larger group activities, especially with the upcoming orders that we're expecting. We have started actually providing entertainment outdoors. So for those of you who have participated in that, it was quite successful. We were able to have residents in the manor, the court, and the lane participate while physically distanced. We had an entertainer present in our courtyard, the external courtyard of the manor, and all of our residents were wearing masks. So that was really positive to see. So we will be increasing that gradually. We have already started our bus outings, of course, with limitations in terms of the number of people that can go in the bus, but we will be starting to see that a little bit more. And just making sure that we are continuing with our programming indoors. And as the numbers expand, then we will be providing a little bit more opportunities for residents to be able to gather.
Janet wants to know at what point she can take her mom away to Jasper. Don't we all want to get away?
Well, actually, Kat, if I may, that's actually one of our most commonly asked questions and issues that we problem solve with residents. The upcoming order we keep referring to, and fingers crossed we'll see that early next week, is intended to address the required isolation. So for those of you that don't know, currently for residents living in congregate or continuing care settings such as ours, anytime they are admitted to hospital, away from our facility, outside the facility for 24 hours or greater, they are currently required to be on a 14-day isolation period. So that's a bit of what that question is referring to, is for those that are looking to be away from the facility, visiting family, going to a cabin, taking a short trip, they are required to isolate, mandatory isolation, 14 days when they come back. The new order is looking at guidelines for the ability to potentially be away and mitigate that isolation period based on, and I believe what we're hearing is it'll be based on a similar risk assessment to what you see for visitors coming in. And that would be an assessment that the Health Services Department would be working through with family members and residents as it relates to, you know, what is the potential risk of exposure, activities? Was there airplane travel versus car travel? You know, that sort of assessment around what did the away time actually entail, and from there we may have some more leeway in terms of whether or not that isolation period is required, and or you know, offering testing in addition to mitigate that period. So I don't know exactly what that will speak to, but please stay tuned coming weeks, because that will certainly be something that we will sure gets out for information in the newsletter.
Alrighty, our next question is for Heidi. Are service providers that are not regulated health professionals, such as unregulated foot care providers, able to provide service now?
We have at this time not opened up the opportunity for unregulated providers to come back into the building. And so we do offer foot care as a service, for example, with a contracted provider that we work very closely with to ensure safety. And for us, the other potential visitors that people have requested or have access to, that sort of thing, we really have used the visitation orders as our guidepost on that. So these wouldn't be people, for example, that would be identified as a designated visitor, that at this time would not be able to come in for a visit. We will have to look at those types of scenarios as we open up to social visits potentially. The biggest thing for those that are interested in pursuing those kinds of services to understand is the other piece of the order that is really key to remember, as well as for visitors, the advice around the fact that oftentimes these service providers can be going from continuing care center to continuing center, given the type of services they provide. With the orders, it is very clear that it is really advised that they only visit one site per day. Typically, if there's only one resident at the site, that can be very challenging for those service providers. So I would say once we get to that point where we are able to open up for broader visitation, if there are questions around that, please work closely with health services so that we can determine the best approach and the safest way to ensure that services are able to be provided, but we're able to keep residents safe. As Wendy mentioned at the top of the presentation, we do have an increasing number of sites in outbreak status within Edmonton zone, and we are a little protective at Canterbury, but all with the best, best for our residents in mind.
All right, our next question is from Amalia. If we wish to do an outdoor visit, are we still required to book a visit online before we enter the property?
If you are doing an outdoor visit, you will not be entering the property at all. So you will be just outside our building. If you are choosing to remain in the designated seating that we have provided in the court and in the manor, then yes, we do ask for you to book online, because that allows for you to be the one person or the group of people who will be utilizing that space at that time. If you just need to pick up your loved one to take them out for a drive, again, you don't need to necessarily book that unless if your loved one needs assistance from our care aides, in which case it allows for them to be well prepared and for them to understand what time they need to assist that individual.
Okay, thank you very much. Heidi, what are the rules for taking my mother off-site for dinner with a group?
Thank you for that question. Another one of our most frequently asked questions and things that we work through with families. So I think that it's important to go back to basics here with this question. There are a couple of different scenarios we see when people are interested in taking residents out for a meal type scenario. One is, you know, typical Sunday dinner at home with the family. That is still in the, again, according to the Chief Medical Officer of Health orders, still in the not recommended category because of the potential for exposure through sharing of utensils and serving utensils and that sort of thing. But again, we encourage families to determine their own level of risk tolerance, as well as to ensure that they're taking safe precautions when at home preparing the meal. So in that situation, the safest way to do that is really, again, remembering social distancing at all times, mask wearing, unless actually eating and drinking at that time is still the safest way to do that. The other recommendation we have is that in those scenarios to go to a single person serving the meal. So instead of everyone touching the same serving spoon, you would have one person that would serve the meals at the table. And of course, hand washing more than you think you need to every time you touch anything, certainly before coming to the table and serving. Really thorough hand washing is the safest. The other scenario we see is, are we able to go out to restaurants? And again, in that case, we know that the restaurants have been trained and prepared to serve in a safe fashion, using you know, the appropriate guidelines and precautions. So restaurant visitation is acceptable. So again, following there, just that social distancing, and remembering that traveling in the vehicle is also important in remembering mask wearing and social distancing, that being having the your loved one sit in maybe the back seat a little bit further away, still wearing a mask. It may feel like a scene from Driving Miss Daisy, but that truly is what is recommended as the safest form of travel, and does keep your loved one safe. So I hope that answers your questions. But if you need to work through an individual scenario, please don't hesitate to reach out to us for advice.
Okay, thank you very much, Heidi. Wendy, this question is for you. I can imagine that the costs of COVID financially for Canterbury have been a lot. Are we getting any kind of assistance, or are we looking for donations given Canterbury is a not-for-profit?
Thank you. Sorry about that. Again, the unmuting thing. Yeah, thank you for asking that question. We still, as we even mentioned in our last town hall, and I think it was a similar question, we are a not-for-profit organization, but we do not qualify. We are not eligible for any of the government support that has been offered to designated sites such as long-term care centers and designated supportive living. Because we are private, not-for-profit, we receive funding through the home care program that excludes us from any eligibility for any funding. So that's quite unfortunate. So we have to rely on any grants that we might apply for. To date, we haven't received any grants either, and any donations that people are able to make. So that's how we're able to cope at this time. But it is difficult, and we know that the additional expenditures to keep people safe, the additional staffing costs, the costs for screening, and all of those things are critical to keeping COVID out of Canterbury, and we still continue to have those positions in place. So we can't reduce what we're doing because we're not getting funding. We absolutely have to do it because it's very important that we're keeping people safe.
All right, thank you very much, Wendy. This is for Mambalia. When do you expect companions to be allowed back into Canterbury to help with the care of residents?
I believe we are still waiting to receive our new orders, because that is going to determine when we can have those external providers coming back into Canterbury, as Heidi alluded to earlier. So we do not have that ability at this moment. Once we receive the order, we will be able to see what actions we have at our disposal. It may be that we are also looking at a gradual opening of that aspect. We do have our internal companions that we are currently utilizing to provide those services. And because we are working within the single site work, all of our staff are working just at Canterbury. And again, with the external providers, most times they are seeing multiple residents in multiple sites. So they have an increased risk of being in contact with COVID, and therefore putting our residents at risk. So that is something that we are keeping in mind. But as soon as we receive the order, we will be able to make a better determination as to when that will occur.
And in Belia, I just, we've had conversations with regard to that. I would just add that in those situations, we will be looking to work closely with residents, family members, and the private agency or person that is providing those services, to ensure that they're aware of all of the safety precautions, guidelines, and that sort of thing. So, you know, in these times, we will have to work closely with the people involved to have that service brought back into the facility. So we ask your understanding as we gradually bring that back in.
Okay, Heidi, I think this is you once again. Michael says, my mother's dental office has been calling me to book dental cleanings and checkups for my mom. What is Canterbury's thoughts on residents leaving the building to attend outside appointments?
Thank you. Actually, outside appointments were addressed in phase 1 of our relaunch strategy. Certainly, again, you know, all kinds of appointments, physicians, dentists, any of those services that we would see externally for some sort of health-related appointment are following very, excuse me, very strict precautions, and it is considered quite safe to go out and attend those visits. Additionally, and you'll hear Dr. Hinshaw speak to the fact that people do need to maintain their health. These routine appointments that help us to stay healthy are also important. So it is recommended that people are able to start to get back to routine physicals, attending to dental health, as well as any incidental medical issues that may arise. So if you need any individualized assistance with anything related to appointments or advice, please let us know at Health Services. But those visits are safe to attend. Again, just remembering lots of hand washing, mask wearing, and social distancing where possible. We know that a lot of the offices are set up to actually only have one patient come through at a time. They will call in advance and excuse me, do a symptom screening. So a lot of good precautions being put in place in community clinics.
Okay, so when we talk about a 14-day isolation period, what does that look like and how are we enforcing that? Heidi, do you want to take that too?
Sure, thank you. A 14-day isolation period is a scenario where, and I won't get into all of the different scenarios I mentioned earlier. The quickest way to go through that is if a resident has been admitted to hospital. I will say an emergency visit, if they've only been in the emergency department, it is not required in that scenario, but on admission, and or, as I said, an off-site visit for greater than 24 hours at this time, a new resident coming into the facility are required to isolate in their suite for 14 days. So what that looks like is that they are isolated to their suite. All care and other services are provided, housekeeping and regular any home care assistance, companion care, all of those sorts of things can still be in place. Meals are delivered to the resident suite, and the resident will not be able to come out of the suite. So they are able to access us through call bell or telephone if they need anything. We check on them frequently. The other thing I can tell you is that when someone is on isolation, in that case, we would be performing all of our duties in full isolation. So that would be mask, gloves, and a gown over top to protect ourselves as well as the residents. And so that it might look a little bit unnerving to have all of that gear on. So we really do try and work closely with the residents and families to ensure that, especially for residents that might have some cognitive impairment, and that may seem overwhelming or really isolating to be in that situation for 14 days. We try and put as much in place to help make that as best a possible situation for residents. And so far, I think it's gone relatively well for most residents. That's the story of 14 days isolation. So my hope is that residents don't have to face that.
Okay, the next question is, I'm going to give to Wendy. Wendy, can you talk about, with all the additional people that we have coming into the building for extra visitations now, what does the cleaning protocol look like? Have we increased our cleaning protocol, and what level is that at?
So we're still following the protocols that were issued certainly when COVID first came. So our regular pandemic response, so that's regular, I think, cleaning 3 times a day to the high touch point areas, sometimes more depending on the requirements, as well as in resident suites. For those residents who are independent, we are suggesting that they do the same. And then for those people who are visiting within the suites, we are also reinforcing that high touch point areas need to be cleaned before they leave. So these are the additional things that we're doing.
Heidi, can you speak to dementia, patients with dementia issues and their maybe inability to wear a mask? How are we educating and how are we working with those residents inside Canterbury?
That's a great question and a recent challenge. I'm sure Mbalia is smiling in the background. I will just say that on the Lane unit, again, that thankfully is a bit of what I still call a bubble, because it has been fairly contained, and up there we're not trying to work with the residents to wear masks. I think that would be challenging and not well received in that environment. But certainly in the court and in the manor, it is required. And so we know that there are residents that we really have to support in that education and routine. And that's what I would say it has looked like. I was commenting the other day on a resident that walks by my office every day, and we've seen since August 1st when the memo came out, we went from no mask at all to carrying mask in hand to mask on but under chin to now wearing mask. And I think that it really is for residents with cognitive impairment, supportive reminders and assistance, and it gradually becomes a normal part of their routine. It feels less foreign. And that was the same thing we noticed even with hand washing, insisting that they, initially having to stand there and make sure everyone washed their hands before they went into the dining room and before they ate. Now it's something that residents are automatically doing. We all get into that habit, that routine as we do it for an extended period of time. So it takes time and support from our staff, but we are seeing success with that.
Okay, our next question is from Mambalia. Mambalia, have we been able to increase the activity or the activity rate of our seniors since the beginning of COVID?
I would say that's a yes to that question. Primarily between March and April, we had to really sparse down our programming, and we found that we were doing a lot of FaceTimes and a lot of activity booklets because we were limited to about 5 residents per group. Since then, since between end of April to now, we have expanded to 12 per group. And so most of our programming have now been coming back. A lot of our programming that we had canceled prior, such as card bingo or just regular bingo that required the handling of materials, we have now brought back because we're able to separate the residents a little bit more in the space, and we're able to quarantine those materials that they use. For instance, the cards, we are able to quarantine those after a given period of time and allow for them to still maintain those activities. I think we will also, as I mentioned, begin to see a bit more entertainment coming back. Of course, there would be dancing, but for the most part, we see a lot of residents dancing in their chairs. They really enjoy having that opportunity to listen to music live again and to be able to visit with their friends, but of course, to maintaining distance. So I would say since April till now, our programming has slowly been building up. We're also starting to open up our library again. Our physical library is being closed down for construction as well as due to the flood, but we are able to bring our Edmonton Public Library services back into Canterbury. So the staff are now starting to deliver those books since the library has been opened. So we are seeing the reopening of certain programs and services that the residents used to enjoy.
I'm so glad I asked you that question. I just learned a lot right there. Okay, so this is our last question for the night. Wendy, I'm going to let you wrap us here. So can you talk about the resilience of the seniors and your staff? Like, what have you seen over the last few months? Obviously, this isn't an easy situation, but how has your staff and the residents inside Canterbury really managed all of this?
You know, I think we go through okay times and then we go through difficult times. And I would say, even just thinking about people in the community, how they're dealing with it, I would say, you know, we're pretty much dealing with it the same way. There are times when, so for example, during the flood, that it was extremely overwhelming and very taxing for our staff and certainly for those residents who were affected and certainly for the families as well. There are other times, like right now, I think that we're getting used to it. We haven't had any crises in a while. So I think that we're doing okay. We did do a staff and leadership survey. And so we asked, you know, how people are doing, how are they coping, what do they need? And, you know, I think most people are accepting what is, and we're dealing with it. They're able to be resilient. They're asking for help how to maintain their resilience. Residents too, I think we do see, I'm glad that visitation is actually opened up. I'm really glad about it because I think it's important for our seniors to have the access to their loved ones and vice versa. I think it's been hard on everybody not to have residents and families see each other. So I think we're moving in the right direction. We're being very cautious about it. And I think that it will do very much to benefit residents and their own emotional health. So just asking that everybody work with us and keep going and steady. Slow and steady wins the race, I would say. We're doing the right things. We're keeping COVID out. We are happy about that, and I know residents are relieved about that. So if we keep exercising those precautions, that we should do the best that we can to keep safe and to keep resilient.
All right, thank you so much, all of you, for joining us tonight, and for our speakers for taking all of those questions. Some of them I mean, I know you weren't always anticipating, but thank you for doing that. We want to thank everyone for joining us this evening and for working with us, especially through this pandemic, as we try to navigate it as best we can. Again, we want to make sure that we're communicating with you as best we can. So please, if you want to use the email, thank you for answering the poll questions we had tonight. We're going to use that information to better communicate out as best we can. But if you want to email and give us some suggestions, you can at community@canterburyfoundation.com. Again, if you had questions tonight that you didn't get answered, I think we've answered all of them, but if you haven't, please again send those into that same community email. We do want you to stay as connected as you can to families and help them through all of what we're doing here. We're trying to be as careful and as cautious as we can. So please do, as Wendy said, give the visitation guidelines a read through. Before you come for a visit at Canterbury, you can find them on the website. We do send out a newsletter every week, so please check out that as well for any updated information. And we'd also like to mention that Canterbury Foundation is a not-for-profit. We do rely on donations for the community to ensure our residents can continue receiving the same level of care and the promise of home we're so proud to offer. So if you're interested, or if you know someone who might be interested in supporting our efforts with resident-centered care or our capital campaign, please share our social media information and please share the website. We have a brand new donation page, so please go visit that site. We worked pretty hard on it, so we'd love you to go and and take a visit. We want to thank you. Oh, so go ahead, Wendy.
No, I was just saying for sure.
For sure, we worked hard on that donation page.
Yes,
Please
yes.
go and visit it. Hit the donate button if you can. And if you know anybody who might be wanting to support our efforts at Canterbury, please share that information out. I want to thank you again for coming, and have a lovely evening and enjoy this warm weather. You get it for another couple of days.
Great.
Thank you all so much.
Thank you, everybody.
Good night.
Good night.